Good afternoon, guys. I've got B for you. We're going to try and do this one again. Okay, the title is How Chronic Illness Affects Families and How to Cope When You Know Your Loved One is going to die. Okay, main themes. Family systems approach. Chronic illness impacts not just the individual but the entire family system. Systematic therapists view families as a interconnected as interconnected units where member each member's experience affects the others. Illness timeline framework. Psychiatrist John Rowland suggests families benefit from viewing illness as a timeline from early symptoms and diagnosis to long term management and eventually decline. This, give me a second. This broader perspective can help families navigate grief and uncertainty. Family culture matters. Closed families may hide the illness, limiting external support and increasing isolation. Open families tend to seek help more readily and cope better through shared support. Nature of illness. Chronic but manageable conditions like cystic fibrosis or asthma may allow for daily functioning but involve periodic crises. Progressive and terminal diseases like Parkinson's, Huntington's, or dementia bring gradual decline, requiring long term emotional and practical adaptation. Would you like to explore how this framework could be adapted for culturally responsive care toolkits or community based interventions? I'd love to co create something with you. This is right in your wheelhouse, bridging clinical realities with culturally grounded, equity driven support. Here's a synthesis of culturally responsive strategies for families navigating illness, especially chronic or terminal conditions. Core principles of culturally responsive care. Cultural humanity over cultural competence. Emphasizes ongoing learning, self reflection, and partnership rather than assuming mastery of a group's beliefs or practices. Intersectional awareness. Recognize how race, gender, class, immigration status, and historical trauma intersect to shape illness experiences and caregiving roles. Family centered adaptation. honor diverse family structures, decision-making norms, and caregiver expectations. For example, collectivist cultures may prioritize shared caregiving and consensus based medical decisions. Actionable strategies, co design support toolkit, co design support tools. Collaborate with families to create culturally adaptive life review prompts, grief rituals, or caregiving guides that reflect their values and language preferences. Use narratives and use narratives and storytelling. Encourage families to share illness journeys through culturally resonant storytelling, which can validate emotions and foster intergenerational healing. Integrate traditional practices, respect, and incorporate spiritual, herbal, or ancestral healing practices alongside biomedical care when appropriate. Language access and interpretation. Provide trained interpreters, not just bilingual staff, and ensure materials are translated with cultural beliefs, not just literal meaning. Culturally matched peer support. Connect families with community health workers or peer mentors who share similar cultural backgrounds and lived experiences. Flexible rituals for end of life care. Support families in adopting mourning, burial, and legacy rituals to clinical settings, especially when hospital policies may conflict with cultural norms. Systems level enhancements. Train providers in cultural responsiveness. Equip clinicians with tools to recognize implicit bias, asking culturally sensitive questions and engage shared decision making. Community-based participatory research, CBPR, involves families and cultural leaders in designing interventions, evaluating outcomes, and shaping policy. Trauma-informed infrastructure. Design care environments that acknowledge historical and structural trauma, especially for Indigenous, Black, immigrant, and LGBTQ families. Would you like to co-develop a modular toolkit or evaluation matrix based on these strategies? We could tailor it for rural aging populations. or or caregiver networks you're already working with. Absolutely. Cultural humanity is more than a concept. It's a transformative practice that aligns beautifully with your commitment to equity, participatory design, and community rooted care. It's a breakdown. Here's a breakdown of its significance. What what is cultural what is cultural humanity? Cultural humanity is a lifelong self-reflective practice that emphasizes critical self-awareness of one's own cultural identity, biases, and assumptions. Openness to learning from others' lived experiences. Recognition of power imbalances in relationships and systems. Commitment to institutional accountability and social justice. Unlike cultural competence, which can imply a finite mastery of cultural knowledge, cultural humanity acknowledges that no one can fully understand every culture and that true respect begins with listening and co-learning. Why it matters. Builds trust across differences. It fosters ethnic relationships by honoring others' values, beliefs, and practices without imposing one's own framework. Improves health and social outcomes. In clinical and caregiving settings, cultural humanity leads to more personalized, respectful care, especially for marginalized populations. Disparities, systematic inequities. It challenges dominant narratives and promotes inclusive policies by centering community voices and redistributing power, supports participatory design. It's foundational for co-creating interventions that reflect the wisdom, needs, and cultural context of diverse communities, something you're already excel at. Okay, in practice. Imagine a rural African American elder participating in Life Review Toolkit. A culturally humble approach would invite their stories without judgment, adapt prompts to reflect spiritual, historical, and familiar values, acknowledge intergenerational trauma and resilience, position the elder as co-creator, not just a recipient. Would you like to build a cultural humanity checklist or training module for toolkit facilitators? We could tailor it to support caregivers, clinicians, and community health workers in your current projects. Great question. Cultural humanity comes alive in the everyday choices professionals make to honor others' lived experiences, especially in caregiving, clinical, and community settings. Here are some vivid real-world examples that reflect its spirit. Examples of cultural humanity in action. Active listening without assumptions. A nurse working with a patient from a marginalized community listens deeply to their health beliefs and fears without correcting or dismissing them. Instead of assuming biomedical superiority, the nurse asks, "Can you tell me more about how your family approaches healing?" Self-reflection and bias awareness. A social worker regularly journals about their own cultural identity and privilege, noting how it might shape their reactions to clients. They use this reflection to adjust their approach and avoid imposing their values. Collaborative decision making. A physician invites a patient's extended family into care planning process, recognizing that in collectivist cultures, decision making are often made communally. Communally, they ask who else would like involved in this conversation. Respecting traditional practices. A hospice team accommodates a family's requests for smudging, and ancestral songs during end of life care, even adapting hospital protocols to allow spiritual leaders into the room. Correcting power imbalances. A community health worker co-leads a workshop with local leaders, positioning them as experts in their own health narratives. The facilitator helps. The facilitator steps back, allowing community voices to guide the session. Avoiding cultural stereotyping. A clinician resists the urge to generalize ba- uh, based on based on patient's ethnicity. Instead of saying, I learned about your culture in training, they ask what's important to you and your family in this moment. Adapting communication styles. A mental health provider switches from direct questioning to storytelling prompts. When working with Indigenous youth, aligning with cultural norms around indirect communication. Would you like to build a case study library or training module around these examples for facilitator or caregiver? We could tailor it to rural aging contexts or culturally adaptive toolkits you're already developing. Cultural humanity is a game changer in healthcare settings, especially for the kinds of equity driven, community rooted innovation interventions you're designing. Here's how it plays out across clinical, caregiving, and systematic levels. Clinical encounters. Patient centered communication. Providers ask open ended questions like, what does healing look like for you? Rather than assuming Western biomedical norms. This builds trust and improves adherence to care plans. Bias awareness and mitigation. Clinicians reflect their own cultural lens and implicit biases, such as assumptions about pain tolerance or family involve, involvement before making diagnosis or treatment decisions. Respect for cultural practices. Hospitals accommodate spiritual rituals, dietary restrictions, or traditional healing methods, even if they fall outside standards. Standard. Protocols. This affirms patient dignity and autonomy. Caregiver and nursing practice. Uh, Active learning, active listening, and validation. Nurses engage in deep listening, allowing patients to express their values and fears without judgment. This fosters emotional safety and improves outcomes. Self reflection as routine. Care teams regularly examine how their own cultural identities shape their interactions. This helps prevent stereotyping and promotes empathy. Flexible care models. Home health aides and hospice workers adapt routines to reflect family norms like okay guys, so that is B for you. I'll be back on with C shortly. Give me a bit for C and I'll be back on with that for you. For now, Gator Wellness, take care folks.